Good afternoon and evening, everyone. Thank you for joining us for Succeed with Biomed's Top 10 with Heather Schofield and Rhianna McFadden. My name's Heather, and I'm the Education Director and Medical Advisor with Biomed, and I'm really excited to be able to talk tonight about Biomed's Top 10 and why practitioners and patients are having such great success with it. With me also is Rhianna.
Hi, everybody. Good afternoon and evening. I'm Rhianna. Heather introduced me briefly, but I'm the Regional Account Manager for Eastern Canada, and my background is in health and wellness. I studied kinesiology, and I'm also a holistic nutritionist with lots of experience in this area. I have expertise in speaking on nutrition and health, and I can't wait to get started with tonight's webinar. Okay, so Top 10 success. So right now I just want to talk about the benefits to your practice and why we selected these top 10 products. So we've chosen these top 10 products simply because you chose for us. By popular demand, these are our most used and most liked by our practitioners, so that's why we've chosen them. If you can only recommend 10 Biomed products to heal your patients, these ones will give you the success and results you need with your practice. Our products, one thing that we have to stand behind our products is over 20 years of research-backed and clinically proven results. Your peers love them and order them again and again. I mean, the proof is in the pudding, kind of. These are products that are selected because they're so wonderful, but also because they're our top sellers for Biomed, and I guess that means they're the top products that are used from our practitioners to their clients. The other thing, right now we have a new president, his name's Gavin Ma, and with him comes so much knowledge in regulatory affairs and getting NPN claims and numbers, and he used to be on the board of directors for the CHFA. I don't know if he still is, but so we have the most up-to-date health claims with our NPNs, which is amazing. We have anything that comes out that's new on, even if it's melatonin, we'll be able to get that claim added to our product. And the other thing is they're reasonably priced, so they're affordable for your patients, and that means more money back in your pocket and into your business because you can charge what you want. We do have a recommendation, but it's going to mean, if the price is affordable for you, it's affordable for your patients, and they'll keep coming back. So it's a wonderful win-win circle. With that said, I'm going to go to Heather.
Okay, Rhianna and I, we're going to be sharing the content for tonight's webinar back and forth, and so that way you get lots of variety for listening with both of us, and also areas of expertise that we both have. We both understand these top 10 products really well, and we have different personal experiences and have had different conversations with practitioners, so we're going to bring all of that to the table for everyone tonight. Okay, so just a quick review of what we're going to be talking about. So Biomed's Top 10, we're going to be covering things like gut and probiotics, sleep, thyroid, immune, bone, stomach, and more gut, the nervous system, circulation, cardiovascular, and neuroprotection, and acid-base balance. And then we're going to finish everything off with a wonderful healthy gut protocol, which is relevant for every single patient that walks through your practice to heal the gut and can become a foundational component of protocols that you're using with patients to get faster health results. And so we're going to start tonight with BioSci, the top 10 success using BioSci. Now, the one thing to just understand about BioSci in general is it has been and still is Biomed's #1 selling product. Sometimes when we're talking to practitioners, they will ask us, what are your top 10? This is our top 1. And so this should technically and is very relevant to be in every single practice across Canada. So just a little bit of information about the thyroid function. And so there's certain nutrients that contribute to proper production of thyroid hormones. And then there's also factors that inhibit this. And so things like iron and iodine and tyrosine, zinc and selenium, and then a variety of vitamins are very beneficial for thyroid hormone production. Things like stress, infection, trauma, radiation, medication, fluoride, toxins, autoimmune conditions are all things that can inhibit this. And so what we want to be doing when we're using a thyroid formula is making sure we're supplying all the nutrients that are going to be able to support the thyroid hormone production. In addition to the hormone production, you also have the conversion of T4 to T3, and so you want to make sure that you also have the nutrients that are going to be helping to increase that conversion and support that conversion. And of course, then there's a whole other variety of stressors that will not support that conversion, and those factors are very similar to those that are prohibiting thyroid hormone production. So then, just in general, TSH production requires protein, magnesium, and zinc. T4 production requires iodine, vitamin C, and B2, and T3 production requires selenium, and then also a healthy functioning liver and adrenal glands. And so Biosci basically covers off all of this. To normalize TSH production and secretion, you've got the selenium and the zinc. To support the thyroid hormone production, you've got iodine in addition to the selenium and zinc. Be able to do the conversion of T4 to T3, selenium and zinc again are the key nutrients for that. Being able to optimize thyroid hormones is L-tyrosine, and finally, to balance plasma thyroxine concentrations and increase metabolism, the protein hydrolysate. And so, and this is the other part. For many of you, you may be thinking selenium and zinc and iodine and L-tyrosine. These are ingredients you're going to find in any well-rounded thyroid formula, but it's the protein hydrolysate, specifically in Biosci, that is really what's the magic bullet in this formula and why it works so well. And as far as I understand, there's no other thyroid formula like that in the market. It has huge amounts of component to be able to balance the thyroid as if you were working with a thyroid hormone or thyroid glandular. Okay, so then patients running on empty, are you seeing patients that are tired, they have dry skin, hair loss, maybe infertility, frequent or susceptibility to infections, weight gain, constipation, cold sensitive, maybe muscle weakness, or just plain old running on empty? Then they are definitely candidates for testing and using Biosci. It's formulated with minerals, amino acids, and protein. That protein hydrolysate, which I mentioned, is the secret ingredient in here. And this is going to help support healthy thyroid function, boost metabolism, so therefore better energy, less cold sensitivity, better ability to manage weight, and also be able to handle stress better and fatigue that can be related to stress. This formula has always been well known as a hypothyroid formula, and so works beautifully in cases of hypothyroidism, or if you're measuring the basal body temperature and you're finding that people are in that subclinical hypothyroid zone, then this Biosci really has the ability to get them out of that and back into the normal thyroid function. Okay, so that is our number one, Biosci. Oh, and one more thing, and here's something, so this is exciting, and as Rihanna said, like our top 10 have been voted by you, practitioners, who are finding amazing results with these products. So Dr. Natasha Turner, she's a naturopath in Toronto, and she is very much in the media, and she writes books, and this is her most recent book, The Hormone Boost. And in here, she has a protocol, and Biosci is part of her protocol for boosting hormones and balancing hormones. And so Biosci has made it as a star in this book. And so she definitely is voting Biosci as a #1 product to be using and finding amazing results with her patient base. So our next number 10 top seller is Probiotic 7-in-1. This was one of the original multi-strain probiotics that was available, and it has huge amounts of benefit. So probiotics in general, most of us are really familiar with when we use probiotics, and it's hard to classify just probiotics are for this or probiotics are for that. We know that they're for gut health, it's for flora and fauna, and helping with things like anything that's related to gut health, so things like allergies and infections and UTI and digestive issues and dysbiosis. It works kind of in all of these realms, but probiotics are really important for mood, and they're also important for weight management. They're important for general health because the microflora and the microfauna are playing such a huge role in our overall health. There's 400 different species that exist in the gut. And one of the things is, because of that, you don't want to be giving the same strain, the same single strain over and over and over again. Sometimes, even though it's a healthy flora component, if it's the same thing over and over, you may be building up one species too much and then not being able to have the proper balance. The other thing, as you know, the flora and fauna, they can become altered in the gut due to diet, stress, antibiotic use, antifungal use, steroids, oral contraception. And oral contraception, there's an important component. How many of your female patients that are in childbearing age are actually on the pill or some sort of oral contraception? I bet you that there's a good portion of them. So that means that their gut flora and fauna potentially are being altered, and you want to make sure you're using a nice broad spectrum probiotic to keep all of that well populated and healthy. And then the last thing, again, we know about the digestive component, but there's also the detoxification component and keeping a strong immune system. It's a very highly evolved, localized immune component in the gut. And probiotics are what serve that. Okay, so then here's the strains that are found in probiotic 7-in-1. There's lactobacillus, there's lactococcus, there's bifidobacterium, and then there's a streptococcus. And they are using a variety of indications like gut health and female health and immune health, just to name a few. And so we will be sending this presentation to everybody, and so you'll have a copy of it. You'll have the slides that include all the slides here, so the initial thyroid function slides that we talked about, and also this slide here with the probiotics and or the strains and the mode of action. And so this is some of the stuff that we hear about, challenges and then solutions with probiotic 7-in-1. So the first challenge on the label, it does have in the non-medicinal ingredients skim milk and soy peptones. So the moment you read those, you're like, oh, I don't necessarily want to be considering this. But it's very common in a probiotic. Here's the reason why. The probiotics, the ones that we have for probiotic 7-in-1, they're freeze-dried. And through the freeze-drying process, in order for them to survive, they have to be freeze-dried on the skim milk and soy peptones. And so in the end, it doesn't exist in the finished product, so the product that's found in the bottle. However, because it's part of the production process, it does have to be labeled. So rest assured, this is not a formula that has milk or soy in it, but it was just part of the manufacturing process for the survival of the species. And then the second part is this freeze-drying process. It's a patented process, and what it does is it allows these probiotics to be heat stable and shelf stable. And what that means is, from a shelf stability component, you don't need to refrigerate it, probiotic 7-in-1. They are able to survive until the last day before that bottle expires. It still contains exactly what it says in there as far as the millions of species. The shelf stability means that you don't have to put in the fridge. It also means you can travel with it. For people out of sight, out of mind, this is a perfect probiotic for them because it's not going to get lost behind the milk and the other things that potentially are in the fridge. And then finally, this millions versus billions in capsules. I know it's very kind of trendy right now to be using billions in capsules and not so much potentially for millions. However, here's the thing. In the billions part, again, sometimes it's, and I'll use the analogy of sperm and egg. You need to get one sperm to the egg in order for fertilization to happen. But there's a lot of sperm, millions of them, that are released in the hopes that one makes it through. And this often is what's happening when you're using billions of species or billions of individual probiotics, is hoping that some of them make it through. Again, back to our patented freeze-drying process. This allows us to have this targeted approach. We don't need as much per capsule because our probiotics survive the stomach acid and then they colonize in the ileum and the colon. And so therefore, we are getting through what needs to actually get through. And that's the part that's most important. It gets through and it colonizes and then it starts to have its beneficial effect. And so keep that in mind. There's a lot of biological medicine practitioners in Canada and in the United States that really feel like if you're giving too many probiotics, you may not be doing the best service for your patients. The other thing is if your lawn is not healthy, so the intestinal tract, and you're putting all these seeds in and the seeds don't take, then you're just putting a lot of seeds in for no particular benefit. So you really do want these probiotics to survive, colonize, and then have their beneficial effect. Okay, so then use the targeted approach with probiotic 7-in-1. As I mentioned at the beginning when I started talking about this, this is our #2 product, and it has been from as long as I've been with Biomed, which has been 14 years. And so it's because it is a tried, tested, and true probiotic with a very targeted approach, 7 unique strains, doesn't need to be put in the fridge, super travel friendly, and it really colonizes the ileum and colon, and in the end, that's the most important part when we're working with a probiotic. Okay, and so I'm going to now pass the floor over to Rihanna.
Okay, so now we're going to talk about melatonin. So this is top 10 success. This is our melatonin plus B6. Wonderful formula. It's in a higher potency than you're probably used to. There are a couple of formulas out there, but I'm going to talk a bit about the normal benefits of melatonin, and then I'm going to get into more of why you would think of melatonin in other ways that you may not initially think of in terms of cancer protection, antioxidant profile of melatonin. So the melatonin is produced, it's a hormone produced by the pituitary gland, and as we age, or if we're exposed to, electrosmog or too much light at nighttime, our pineal gland stops producing melatonin, and this can cause a lot of undesirable symptoms. So with melatonin, what it's going to do, you're going to fall asleep faster, stay asleep longer, and wake up refreshed. Again, it's the hormone that regulates sleep. Taking melatonin can help promote natural sleep, and it can improve your quality of sleep. That's a big thing. It's not necessarily how many hours you get, but that quality sleep where you're able to get that REM sleep where your body's doing a lot of repairing and regenerating. Our melatonin is a high dose, 10 milligrams, with the B6 that helps with the absorption of it. It's a rapid dissolved tablet that tastes wonderful. I look forward to taking it. I don't actually need it, but sometimes when I feel like I can't get to sleep in the middle of the night around 2, I'll take one, and I just love the taste of it. It's non-addictive as well. Again, it has the B6 for absorption, and the main thing that differentiates melatonin from our typical use that we think of is the strong antioxidant and anti-inflammatory component it has for the brain, neurological functions, heart health, and cancer protection. Next slide, please. Okay, so decreased melatonin production and sleep issues can develop, as I said, with aging, but also lifestyle factors that I touched on with like exposure to our laptops or the TV. Ideally, we should be falling asleep with the sun setting and waking up with the sun rising, but in our busy lifestyles, nobody follows that anymore, and that's why we do have melatonin to help us when we lack our natural production. So it's supportive for difficulty falling asleep, insomnia, waking in the night, which I said I take that for, and it works really well. I know a lot of practitioners have a great feedback from this product and love it. Jet lag, shift workers. I mean, when you're a shift worker, it's really hard to change the circadian rhythm and get back to your biorhythm because it's really challenging. So melatonin can help you. At least it gives you the melatonin your body needs. It's also helpful with seasonal affective disorder, SAD, and those depression pictures that we have. So people that are depressed can really utilize melatonin. Sometimes they can't fall asleep or their sleep is just not restful enough. And the main thing that I love about this is the antioxidant protection, the anti-aging. So I want to talk about this a little more. melatonin is able to cross the blood-brain barrier, and that's what allows the additional benefits of melatonin to work not only as a sleep aid, but also helps with anti-inflammatory, brain injuries, heart health, and acts as a neurological protection agent for the body. It can also increase cognitive function. So if you're not sleeping properly, you can start to notice a decline in your ability to focus or concentrate. And, as we age, we also get, early Alzheimer's or different things like that. Well, this can also help with that, something you might not think about, but it is something that melatonin is useful for. And one great thing that people are using this for is with cancer patients. It actually reduces the toxic load and effects of chemo drugs on patients going through the horrible treatments and therapies, as well as just the high-dose antioxidant helps with people who have cancer or as prevention. There's other things that it's used for. There's melatonin deficiencies that you wouldn't normally think of, but somebody who's had gastric surgery, they're most likely to be deficient in melatonin. Depression, again, like I said, and it can actually help if somebody has fibromyalgia, they're usually going to be deficient in melatonin, and this can also help them as well. It's a beautiful formula, and there are some people in Vancouver that actually take higher dosages, like 10 milligrams seems like a lot, but they take, I know, Heather, between 60 and 100 milligrams. Is that? Anyway, it's quite a lot of melatonin. Yeah.
They take, so there's a cancer clinic here in Vancouver, and they are using with their patients 50 milligrams a night. And then there's also a group here in Vancouver that are using it for not only sleep, but also for lucid dreaming and astral travel. So that's kind of getting out of our scope here. But they're taking 200, 400, 1,600 milligrams a night. So, of course, as I said, that's just completely out of scope of what we're talking about. There are safety studies that are done in the Netherlands, 75 milligrams a night for 4 years with no adverse reaction. So it can be taken at a higher dose for these antioxidant protections, as Rhianna was talking about.
Okay. And the other thing, we really want to get into that quality sleep because that's when our body's repairing, rejuvenating, and regenerating. The 3 R's. That's when, our muscles are growing and repairing, growth hormones released, and metabolic processes are happening. So this is really helpful for all of that. So I just want you to remember that when you think of melatonin, think about all the other things, especially the high antioxidant, cancer support, and even just for the depression and the people that have a lot of emotional issues. Okay, so that's it for melatonin. Now we're going to talk about the top 10 success with the right C. Okay, so I feel, and our company feels, the right C, who Harlan, one of the founder of Biomed, absolutely loves this product. So once I've done my spiel on the right C and why I love it and why practitioners have loved it, there is a full webinar on our site that you can go to, and it's pretty much the whole webinar is on vitamin C and its miraculous benefits for the body. So you can check on our links of past webinars, and I think it's called 40 Years of Clinical Pearls, or something like that. But okay, so the right C. Why would you choose the right C for your practice? I think its use is, again, for everyone. It's a wonderful product. It's a superior absorption. The main thing with the right C is different. It's a sodium ascorbate. So how that differentiates between conventional vitamin C, ester C, or ascorbic acid is that it is buffered with a cofactor, and this is what allows it to get into your blood plasma and past the stomach, the digestive tract. So it's because it's attached to this cofactor called ribopurine. This is what allows it to bypass the irritability of the bowels. It does not cause stomach bowel upsets. In recommended doses, which can be quite high, we'll get to that later, but the therapeutic dosages of vitamin C are a lot higher than we typically think of at 1,000 milligrams a day. We can definitely exceed that. And it works a lot faster and more efficiently than other forms. It is fully reacted with that cofactor that I talked about, so it's like it's being buffered. and it's non-acidic and pH neutral. The one thing you want to do with the right C is you can put it in water, but it's best for the uptake of it because it goes through the sodium-potassium pump. That's a mechanism of getting into the blood. You can also add, it's best if you add something that has potassium in it, either fresh squeezed orange juice, more vitamin C in it, a banana, have a bit of a banana with it, or any sort of natural juice. It's just going to heighten its absorbability. And it doesn't really have any side effects that you would normally typically see. So that's okay. Next slide. Vitamin C, I think it should be the first line of defense for everything. It is, again, like I said, so superior in its uses. I think sometimes we forget about vitamin C because we have so much available to us, but it is an immune system booster. So cold and flus, powerful antioxidant. Again, it's helpful for when the body's under stress, as an anti-aging, to help with, it binds to free radicals and will pull that out of your body, wound healing and collagen production. So if you use this, we can get into protocols after, but for wound healing, you're going to speed up the healing time of, you know, if you've had surgery or if you have cuts or whatnot, as well as if you're an athlete or you're working with athletes and they're, you know, have a heavy weight training day or they're endurance runners, they are going to have small micro tears in their muscles. And this will also help with like the pain in the muscles after and speeding up the recovery. So a wonderful product for that. It helps control allergies and asthma. I'll talk about the protocols for that after, but it's quite unique in the way it decreases histamine levels. It's quite astounding how you can actually use the right C if somebody has like an anaphylactic allergic reaction to something like a bee sting and you don't have anything available to you. There's no EpiPen. You can actually use high amounts. I'll get to the amount later, but I think it's between 2 and 4 milligrams of the right C, and you can allow that person at least the chance to get to the hospital, and it'll bring down the histamine, it'll bring down that inflammation. It's also great for heart health, teeth, mouth, and gum health. You'll notice if people have like a lot of gum inflammation and bleeding of the gums, that's an indication that they're deficient in vitamin C. It also helps with eye health, especially if somebody is diabetic, and neuropathy and nerve pain. And again, for cancer and malignancy, we have, there is, you know, you can, a lot of naturopaths will do IV infusions of vitamin C, specifically for cancer. Well, they're using the same vitamin C that is in our product. They're using the sodium ascorbate. So you can rest assured that it's a really high quality vitamin C that the body can utilize and it stays in the blood. And, you know, if you are doing IV with somebody, this can be supportive as well because you can get those doses up. Okay. This is on the left here. This is a diagram showing you symptoms, and at the bottom, how many grams of the right C you can take within a 24-hour time period to bowel tolerance. So we're looking at something like a mild cold. You can take upwards to 50 grams, and you're not going to see, you know, diarrhea or any of those nasty symptoms. As you know, your immune system is working really hard to fight. The body is actually trying to get rid of the vitamin C. So when you're really, really sick or you're under attack, your immune system's not working well, your body can utilize so much more vitamin C than we think, and you need to dose like a couple times a day to keep that vitamin C in your blood plasma. So you can see at the top there when somebody has like an pneumonia that you can upwards, depending on the person, the size, to 200 grams a day in a 24-hour time period of the right C, and you still won't cause a bowel discomfort or diarrhea because the white blood cells need it, it craves it. On the right side here is the diagram of the vitamin C levels in the blood plasma. So you can see the amount on the left side, and then at the bottom is the time. So if you look at just ascorbic acid, it's quite low even in how much is actually absorbed at its peak time. So it kind of has a bit of a low, and then it increases at 60 minutes, and then it goes back down. So when you compare it to the right, so you can see this big influx in how much is in the blood plasma at 30 minutes, And then there is a downward, you know, a natural decline at about this 1 hour time frame, and then it does slowly plateau down. But you do want to notice that it is staying in the system a lot longer, and that's why you need to, especially when somebody's in the acute phase, keep dosing with vitamin C. Okay, next slide. Okay, so these are the recommendations for vitamin C. Allergies, asthma, and inflammation, it would be about a half teaspoon to 1 teaspoon, which would be equivalent to 2 to 4 grams. Each half teaspoon, which is a serving of the right C, is 2.5 grams. So it's between 2 and 4 grams twice daily, and it must be at least 3 to 4 grams a day to help with allergies and asthma. For the immune system, for just the cold and a flu, it would be up to 50 grams a day at the first sign of bowel tolerance. For pneumonia, it's 1 tablespoon, so 15 grams every 2 to 4 hours. That's what I was talking about. You can get up to that 200 grams a day, because when you're under attack with an acute, like ammonia, your white blood cells are just going crazy, and you really need the vitamin C. Diabetic complications, again, it'll help with blood sugar, and it'll also help against renal and eye complications. That's 1 teaspoon twice a day for the rest of their life. Cardiovascular includes circulation, so I'll get to cell tonic after, but just for cardiovascular health, it's a half to 1 teaspoon twice daily. And the twice daily, as you can tell, it goes out of your body, so you constantly want to have it in your bloodstream. Constipation, this is another way you can use it, because vitamin C, it draws water into the bowels. It's also helpful for increasing a detox response. But if you have somebody who's constipated, you can bring up their levels, and quite quickly you will notice, well, not quickly, but if you bring up half teaspoon to 1 teaspoon every 2 to 4 hours, you're going to finally get them to bowel tolerance, and then they'll finally go to the bathroom. And for wound healing, again, wound healing, also think of like athletic performance and recovery. It'll help you, it'll 3 to 10 times faster wound healing. It's about a teaspoon, 4 grams twice daily. Yeah. And now I'm going to talk about the success of BoneSure. So BoneSure is, I'm not sure if that's our the number 3 product we have, or top 4, but it's up there. It's one of our most well-received, well-liked, and results, like practitioners get results with this product. You can see in the ingredient profile, it's got boron, the algae cal, which I'm going to talk about, which is the calcium magnesium. It's organic, plant-based calcium and magnesium. That's the main thing about BoneSure that I'm going to get into some detail about. How will BoneSure help your practice? Well, calcium is the most abundant mineral in the human body, and it's also one of the most important. We sometimes forget that. Calcium, we always think of calcium in the bones, but it does so much more than that. You know, it helps with heart and blood and nerves and contractions and nerve conduction. It's just, there's so many things that calcium is used for outside of just our bone health. About 2% of our body is made up of calcium. So BoneSure, again, it's a full spectrum bone building formula, and it contains organic plant-based calcium. I didn't put that in here, but it's really important to realize that it's actually organic plant-based calcium, and it is a complete bone building formula with vitamins and minerals. It's bone supportive. It increases bone density. This is a huge claim. This product actually can increase, not just, you know, stop with the decline, but actually increase your bone density. 97% bioavailability and absorption. That's a phenomenal thing to have, especially in a CalMag supplement. When you compare it to regular, like 100 milligrams of regular calcium, which typically would come from limestone or, you know, another type of carbonate, so it's rock-based or mineral-based, you may absorb 10% of that. So you can really see here that if something's plant-based, you're going to absorb it a lot better than, you know, eating a rock. So it reverses bone loss, and it can help reduce your risk of osteoporosis, which is something that we all, as women, are a lot more susceptible to having, but it's really important that we realize that and talk about that. And it helps with heart health. It works with the blood, nerves, like I talked about, to regulate the heart, muscle contractions, and nerve conduction. Okay. Okay, so the key to success with plant-based calcium is in BoneSure. It's this ingredient called AlgaCal. So that's just what is in our BoneSure. That's where we get our formula. It's plant source calcium derived from the beaches in South America. It's a marine algae. You can see a picture of it. It's very, it's kind of beautiful. It's just nothing's done to it. It's just sustainably sourced and created into a powder form, and then we make a capsule out of it. And in this, because it absorbs calcium, magnesium, and 70 other minerals from the seawater, and they bind into a matrix, you're getting so much like bioavailability in the trace elements as well, the trace minerals. It's a sustainable marine superfood. And again, that 97% bioactivity of it is just something I want to force and stress about this product, that the absorbability. And again, the trace minerals, you'll see copper, iron, potassium, and so on. On the left side, this is a study that was done to actually show a person taking AlgaCal versus a person on the left side. You'll see no calcium or vitamin D supplementation. So this is showing annual change in bone mineral density, and it's negative when they don't do anything, 0.75%, 0.75%. With taking what I said was raw calcium or some sort of carbonate, it's negative 0.10%. So no increase. It does help a bit with decline, but no increase in bone density. And on the right, with what's in our BoneSure, you're getting an increase of 1.3%. So to increase bone density is just something that, it's an amazing thing to know that we can actually help the degeneration that's already taken place. So, and that's AlgaCal, or that's BoneSure with vitamin D. Calcium deficiencies are quite common, and they're often overlooked until it's too late. Someone will have a fall, or they'll fracture something, or a hip replacement, and that's when you start to realize, oh my God, calcium deficiency, you don't even think about it. But it's more common than you think, and sometimes the symptoms are muscle cramps. We always think of magnesium for cramping, and oh, you have a muscle cramp, give you magnesium, but there is a correlation and a big connection between calcium and magnesium. And the CalMag in our product will help with that, but you have to remember that you do need calcium as well, not just magnesium. Stress factors, you'll see this a lot in avid runners. They'll get hairline fractures or stress fractures, and it's probably because they're not absorbing calcium properly. They're not getting it in their diet, and they are starting to get stress fractures, and that's not age dependent. That just can happen. Bone density loss, even though it's more common in, after postmenopause, it can happen even when we're younger. Osteopenia, I knew a girl that I worked with that was 21 that had a diet of pop and McDonald's every day, and she had osteopenia, and she was you would never think that, but it was because the phosphorus in the pop was drawing from her bones, and it was just awful. So she had to be on a calcium supportive supplement from very young. Curvature of the spine, osteoporosis, and heart issues. There's a big correlation between muscle contractions and heart health. I'm going to talk in more detail about osteoporosis, but I just wanted to talk about something that is in the media a lot. It's heart attacks and calcium. People are maybe steered away from using calcium, thinking, oh my God, patients are coming in or clients saying, I don't want to use calcium. I'm afraid I'll have hardening of my arteries, or there'll be calcium deposits in my arteries. That's not necessarily true. If you do get enough calcium from your diet, your body, if you don't get enough, your body will leach calcium from your bones to fuel muscle contractions and other vital functions. So if a person doesn't have any calcium in their diet, they can still be pulling from their bones and still create these calcium deposits. If they're getting the wrong kind of calcium, that's not compatible with the body, they can still create these calcium deposits, and they can be seen in the arteries. But it's not because of taking a plant-based calcium or taking a supplement per se. There's also a lot of risk factors that we don't hear about when we hear that statement: age, poor diet, thyroid conditions, and smoking. So it's more the risk factors associated more so than the calcium actually causing the hardening or the deposits in the arteries. Okay, and the second last slide. So this is a picture on the left of a healthy bone, a healthy spinal column, and on the bottom is a person who has osteoporosis. You can see on the top in that bone matrix, it's very structurally sound and well formed, and there's not a lot of space in between the bones. You can tell even on the left on the vertebrae that in between the discs there's a lot of room. There's no narrowing of the vertebral column, and there's no, the discs are not rupturing or anything. And then when you go down to the spine at the bottom, you can start to see degeneration between the spine. You can start to see like collapsing. You can see how the bone in the matrix, it looks very weak and it's sparse, and you can tell structurally that it really can't hold much weight, and that's where you get degeneration in the vertebrae. That's where if you fell, you'd have a hip fracture, have to have a replacement. That's what it looks like, and that's why like you get the kyphotic posture or the person with the curved spine. So that's the picture of what it looks like in the actual bone. So everybody can, like I said, osteoporosis isn't just age-related, but it really just means porous bone, which you can see there. The bottom looks like porous bone. But your risk does increase as you get older. So to diminish these risks, you want to supplement with Bone Sure to rebuild the mineral density, the bone mineral density. Basic tabs, because this is very important, the acid-base balance of the body and making sure it's not too acidic. This will really help with osteoporosis, as well as NAG, which is known to restore intestinal mucosa lining for effective mineral uptake, but also works in between for synovial fluid and for soft tissue between the matrix. The recommendation, Bone Sure, 2 caps twice a day for 3 to 6 months. Basic tab, 3 tabs twice a day. You need to take this with warm water away from food, because you want it just to do its job in alkaline. You don't really want to absorb anything in the basic tab, so it has to be taken with warm water. And the NAG, the NAG, 2 capsules twice daily for 3 months. Okay. Now we go right into NAG. So what is NAG? A lot of people have heard of glucosamine, and they know the benefits for, like I said, synovial fluid or, pain in the joints. But we often forget or don't even really know that outside of that, NAG has very superior functions of healing the gut. So we always think about healing the gut with, putting in, like Heather said, the good probiotics, pre and post probiotics. And, we sometimes think about the healing with other, sometimes glutamine or whatnot. But the mucosal lining, healing the mucosal lining of the stomach is very important, and it's something that we really need to focus on. NAG is a very fast-acting and powerful way to heal the gut. That's pretty much what it does. It heals the mucosal lining. This is just a picture of this single ingredient formula. So that's its actual chemical form. And it's derived from shellfish. So it's the same thing that you would get normal glucosamine from, but it's the molecule that forms the outer shell. So it's just that small layer on the crustacean. That's what is NAG. Next slide. So why is NAG a useful supplement? Why would you want to use this product in your protocols? Simply because we're going to see so many people, and it's more and more prevalent with gut health issues. And we want to create a healthy gut. So we worked on them, we've helped with healing, and Heather's going to talk more about the healthy gut protocol, but we also want to get to helping that mucosal lining. So this is going to be helpful for IBS, inflammatory bowel disease, ulcers, Crohn's, colitis, and any other inflammatory disorders you can think of. So if the body lacks the natural ability to manufacture its own NAG and is unable to maintain the protective barrier, then you get things that go into the intestinal lining, like they make their way through because there's no barrier anymore, like digestive enzymes, which are good, but not when they cross past that barrier, or other potentially damaging intestinal contents. NAG is a basic component of hydrolonic acid, and one of the major substances involved in the formation of connective tissue in the human body. So what it does, it helps maintain the hydration of our tissues, and that's how it helps to repair that mucosal lining, because it needs to stay hydrated. And I think, yeah, so lastly, we're going to talk about supplementing with it. Again, it helps protect the lining of the stomach. It can provide the body with the precursors needed to repair wounded tissue. It can replace the mucous membranes, and it helps with the formation of connective tissue. So this is where you see what I just talked about with bone shear coming into play, because it helps with bones, ligaments, cartilage, and synovial fluid. Again, it's wonderful for musculoskeletal health. So the recommendation for gut healing, 2 caps twice daily for up to 3 months. And for osteoporosis, like we said before, 2 caps twice daily for, I think, 3 to 6 months. And that's it on NAG. Back to Heather.
All right, so just before we get started talking about gastro-ease, I just wanted to mention again, because a number of you have signed on since the very beginning, that for our Biomed Top 10, we have been able to put together this awesome package for all of you that are listening tonight. It's going to be a special Biomed bundle for the top 10, and there's potential free shipping offers with it, and there's savings over $100. So stay tuned to the end, and Rhianna and I are going to share with you what this really awesome offer is for everybody listening. Okay, so gastro-ease. Gastro-ease is a gastric or a stomach formula, and it is used with mastic gum and demulcents to stop the pain and heal the stomach. It is very stomach-related, so GI, yes, but very stomach-oriented in a lot of cases, and ulcer-oriented. So the mastic gum and the demulcents are working as an anti-ulcer, anti-inflammatory, peptic ulcer disease, gastritis, and gastric reflux. It also specifically is used in H. pylori, and so I want to share a little bit more information with you about that. So gastro-ease is going to allow you to be able to heal your patient's stomach. And whether this is due to an ulcer or it's due to H. pylori, it's due to eating a really poor diet, it's due to stress, it's due to whatever the reason is that they're having some sort of gastritis or stomach issues, gastro-ease will come to the rescue. The mastic gum in it is one of the key ingredients, and it is the one that is an anti-ulcer ingredient and also anti-H. pylori. Mastic gum, there are studies that show that it kills up to 90% of H. pylori strains. And one of the things mastic gum does in however it's functioning, it's almost as if it's poking holes into the H. pylori, so therefore it's not actually surviving. And in a double-blind controlled study, it was showing that 1,000 milligrams of mastic gum daily created 80% symptomatic relief and 70% healed in duodenal ulcers, and this is just using mastic gum all by itself. So this formula is really, really strong in ulcers and with H. pylori, and it should be added to all of your H. pylori protocols. Recently, I was working with a practitioner, and she this was one of her main concerns with H. pylori, and she, within a week, started finding that in her patients, symptoms were turning around using gastro-ease and then also absinthium from the Nessman line. So those two products plus basic tabs is a perfect H. pylori ulcer combination. The other ingredients, there's licorice and marshmallow root, chamomile, and fennel seeds. And the dosing is recommended 2 caps 3 times a day. That 2 caps 3 times a day will get you up over 1,000 milligrams of the mastic gum, which supports, the study supports. Okay, so that is gastro-ease. And then next we're going to talk about is liquid iron. This product is the only liquid iron that is in this form that is available. Yes, there are a few other liquid irons, but they're nothing like what we have available here. So features and benefits. Features, taste great, super convenient, non-constipating. I'm sure every single patient of yours who has to be on an iron formula will appreciate the fact that this is a non-constipating form. That's the biggest complaint you hear about iron pills is the constipation. So you don't have any concern with this. And then finally, it's a well-balanced formula because it does contain the iron. It also contains folic acid and B12, and those are very important for red blood cell production. So benefits here, you get great increased patient compliancy, and the reason is because it tastes good, and it's really easy to take, and it's not constipating. And because it tastes good, it also has a child lock on it so that children can't get into it. You can resolve anemia and deficiencies that are all related to iron, B12, and folic acid. And then you get your patients feeling better, you get your patients' energy levels boosted, and you're supporting their red blood cell production. For those of you that are not aware of it, when the red blood cells are being produced in the marrow, they wait before they go into circulation for folate or a B12 molecule to be added on. And so if there is B12 or folic acid deficiencies, you can be getting premature red blood cells, and therefore they're not necessarily going to be able to carry the oxygen in the bloodstream. So sometimes when it's just iron, don't always think about iron, but think about iron with B12 and folic acid to really support the whole production of those red blood cells in the body. So iron, as I just mentioned, B12 and folic acid, all necessary for red blood cell production. Patients, they're tired, they're pale, maybe they've got pale gums, they've got low stamina, numbness and tingling, and then there's a whole variety of other types of things. These all can be signs or symptoms leading to low iron. And so in order to be able to resolve that, these weak and tired patients, you can get these anemias resolved. Because, again, I mentioned it's got the iron, the folate, and the B12. It helps with all these types of anemia, in addition to pernicious anemia. And that's anemia that is due to lack of intrinsic factors that prevent the body from absorbing B12. Okay, so liquid iron then, it's a really simple once-a-day dosage. It's 1 tablespoon that's taken with food. As I mentioned before, it tastes really good, so patients really are compliant. And also, of course, as I mentioned, again, the iron, ferric ammonium citrate. This is that non-constipating form of iron, so you'll get really good success in all of your patients that need iron with liquid iron. And they will continue to come back for more. I mean, as we've been talking about this whole night tonight, patient success and practice success, this is one of the things. We don't necessarily want our patients dependent on us and to be seeing us for the rest of their lives. We do want to get their bodies regulating and get them healthy again, but some people have a tendency towards low iron, and so you can keep those patients coming back when they need to be on an iron supplement and getting it from you, which then is creating more business for you as well, in addition, of course, to patients keeping their health on track. Okay, so then we're going to move to optimum B12, and Rhianna's going to be talking about that. But just before that, there was a question. So that protocol I mentioned for H. pylori and ulcers, gastric ulcers, is GastroEase plus absinthium plus basic tab. And I can follow that up in an email for everybody as well, just so you can have those dosing. Okay, so over to you, Rhianna.
Okay, hi again, everybody. So optimum B12 with the methylated form of, in the methylated form, so wonderful product. Let's go to the next slide. So who needs vitamin B12? There are a lot of people that are at high risk for B12 deficiency. Obviously, the older person, vegetarians and vegans, because they're most likely not getting it in their nutrition, people on certain medications, acid blockers, diabetic drugs, and also certain factors in lifestyle. You can see there alcohol, low stomach acid, digestive problems. So this is an issue, and there are some people who just have the inability to absorb B12 from food. So you can see the main source of B12 is meat, and there's a lot of people who can absorb meat or don't prefer not to eat it. That's why we have optimum B12. The next slide. So these are shocking stats. You can see them very clearly. 50% of adults are B12 deficient, don't even know, and 1 in 2 have dangerously low levels of B12. the symptoms sometimes go undetected or misdiagnosed. I mean, it goes hand in hand with low iron, so sometimes a doctor will just say, oh, it's low iron, but B12 definitely needs to be recognized as something that could be contributing to a lot of, hair loss or just different symptoms. Okay. Next. Why sublingual methyl-forms are ideal? So ours is methylcobalamin, which is the most absorbable form of B12, and it's sublingual. So again, it's going to absorb directly into the bloodstream, so passes that blood-brain barrier. It's my favorite word today. Many of our products do that. It does have the methylfolate, so again, methylation. Anyone who has a methylation problem, you can ensure that they're going to be able to absorb this product. And sublingually, as we know, they don't have to digest it, so there's no malabsorption. It just bypasses that whole area and gets right into the blood. Okay, so there's a minimum dosage of methylcobalamin is 1,000 micrograms daily. So a lot of people don't get that, and they need a higher dose. And sometimes a patient could need 15,000 micrograms daily. So RB12 has 5,000 micrograms. And if you have low stores, you could take low stores of B12. You could take 1 tablet until your stores are where they should be. And then from that point on, for maintenance, you can take 1 tablet every other day, so 3 times a week or every other day. And there's really no issue, as B12 is a water-soluble vitamin, so you'll just, it'll come out if it needs to, if you've ingested too much of it. Next slide. Okay, so our B12, Optimum B12 plus B6 is just as good, if not better, than an injection, even if somebody, needed 15,000 micrograms a day. They both go straight into your bloodstream, and there's really no research that indicates that an injection is far superior to a sublingual. If anything, for ease and compliance, a sublingual is going to be a lot more effective, and you don't have to get a needle from the doctor or go and book a trip and see a naturopath, and a lot of naturopaths can't do injections. So it's just a wonderful product. It tastes great, and it's also cost effective. So again, with B12, healthy cardiovascular system, nervous system, and immune system. So we need all of the health benefits of B12. There's a broad range of them, but you can see Heather talked on a lot of these when she was talking about the iron formula. But prevents anemia, boosts our energy levels, protects our peripheral nervous system, especially in diabetics, helps with our brain, aging, prevents cognitive decline, and normalizes our homocysteine levels, and helps again with heart attack and stroke. So definitely something that we should all be recognizing there's a deficiency in a large majority of the population, at least 50%, especially females, and also, know what to recommend. And this is a phenomenal product. Our practitioners love it, and it tastes amazing. Okay. And yeah, so it's sublingual. It dissolves quickly, tastes great, like I said, and it's very cost effective for patients, and it'll address, B12 deficiencies. And that's it. That's all that's in it, the methylcobalamin and the folate. So Self-Tonic. This is a product that we have had now. It's pretty new to us. It's people pretty much say, okay, what is Self-Tonic? So again, I wrote it right here. Simply put, it increases microcirculation to the blood and the body. That's really what it does. It's a TCM product, traditional Chinese medicine formula, and it's been around for thousands of years. It's nothing new. It's just new to North America, and many practitioners have never heard of this. And we have, the rights to a wonderful product. What's in it? The main ingredients are the Salvia notoria, or the dancing root, and this is really where a lot of the heart increases blood flow, improves myocardial ischemia, promotes the recovery from myocardial ischemia or injury, heart attacks. This is where the main circulatory aspect of the oxygenation and microcirculation this is what it comes from, the dancing. The nada ginseng is called by TCM practitioners as the miracle root for the preservation of life. And borneol is, it's actually a compound that is derived from a tree that's part of the teak family, and what it does, it's used to induce resuscitation. It clears stagnation. So in TCM, they'll talk a lot about like clearing the chi or stagnant blood and getting things flowing. So that's what this borneol does, and it relieves swelling and pain. So altogether, we've created Self-Tonic, a wonderful formula. Again, its uses, it improves cardiovascular health. That was the main reason that we got the NPN for it, for cardiovascular health. But on the bottle, it says heart health and fitness because it does so much more. Anywhere where you think of circulation, where you need more circulation, even if you're doing infusions with, you know, vitamin C or like we talked about, this is something that's going to help with the uptake of the nutrients because of the microcirculation of it. It's going to increase blood flow. You can use it for erectile dysfunction, cold hands and feet, Raynaud's, alleviate chest pain. This is the main thing. So for angina, you just take the pill, it looks like Contact C inside, little pellets. You open it up, and you just would open up 1 to 2, put it under your tongue if somebody has or having an angina attack or even a heart attack, and this will help alleviate the symptoms and bring down the pain. Again, this whole thing about relieving circulatory stasis, stagnant chi, it's all about flowing, moving things through the body, and this is what it's going to do. It's going to keep the circulation of everything in your body. It reduces diabetic complications and neuropathy. Heather has a great story. Her mother had quite a, you can go ahead and talk about this briefly, Heather.
Oh. For sure. So my mother, a few years ago, she went into health crisis and was diagnosed type 2 diabetic. She had a blocked femoral artery. She had stubbed her toe, and the toe started to die, and they were very concerned because an ulcer started to form on the bottom of her foot, and they were planning on amputating below the knee. So through very quick intervention and some very good doctors who were supporting some natural health, she ended up doing hyperbaric oxygen therapy, high-dose vitamin C, the right C specifically, and Self-Tonic. And so she would take the Self-Tonic and the right C before she went into the hyperbaric chamber, and she had 60 treatments. And so she went from having her potential foot and leg amputated below the knee to healing within 6 months. They had no expectation that she would heal at all because the ulcer was 2/3 the size of the bottom of her foot. But in the end, she healed faster, double the speed, and everybody was pretty amazed as far as the doctors go as to what she was doing and why it was working so well. So great example of how Self-Tonic works for microcirculation, and then how Self-Tonic and the right C as a combination work for healing wounds, including diabetic wounds. And then as a final side note, in addition to her being completely healed, she's also on 0 medication. So she's very, very healthy now.
Thank you. Yes, so it's, again, I mean, that was a wonderful story, and it just ties together, but also for optimizing athletic performance. So if you work with athletes and they want that, you know, oxygen in their body, you can take Self-Tonic before a workout, and you're going to feel this, not warmth or anything, but just this increase in oxygen in your body. That's the only way I can explain it. It can lower total cholesterol and increase HDL. The main thing here is clinically studied with no drug interactions. So it's safe with all heart medications. This is something I really want to hone in on. Many people, if they're on heart medications, they're afraid to take anything. And this is something you can take in conjunction with blood thinners, statins, beta blockers. It is safe. And a great thing is it's on its phase 3 FDA clinical trial to be the first non-prescription drug for heart health, for angina specifically. So wonderful, wonderful product. Okay, next. So give your heart some love. For heart health, these are pretty much the dosage recommendations, 1 capsule 3 times a day. Self-Tonic, at the bottom, like I wrote there for you to all see, it has a very short half-life in the body, so you do need to take it throughout the day because it only lasts about 3 hours in the body, and once it's gone, all the effects, the benefits are gone because it just is circulating the body. So you need to take it, you know, quite often and on a daily, for heart health, daily. Angina pain, again, 1 to 2 caps poured under the tongue. Wound healing, 1 cap 2 to 3 times daily, and athletic performance, again, 1 capsule prior to a workout, 10 to 20 minutes. And that's it. Oh, and Toco-x-krill. So Toco-x-krill is, think of this as brain and heart health. That's really what it's going to be phenomenal for. It's a super antioxidant, and it has a wonderful delivery system for the Toco-x-krill. So the Toco side is the Toco-trienols and the Toco-ferrols, and that is the vitamin E profile. So you're getting superior absorbability. It passes through the blood-brain barrier with this Toco-trienol and the Toco-ferrols, which is in the evenol superbio aspect of the Toco-x-krill. So it's this emulsifying delivery system, and what that means, it rapidly transports the vitamin E into the body, right into the blood, very quickly, and with 250% increased absorption then of each vitamin E Toco-trienol. So you're really getting the vitamin E into the body, and it's a high super antioxidant, as we know. So it enhances delivery to the heart, liver, skin, and the brain. And then it also increases the absorption of the krill oil, which is the other aspect of the Toco-x and then the krill. So it also still has the natural astaxanthin in it. I think it's 2 milligrams, but what differentiates this is the krill. So the krill and the Toco-trienols. So in the krill, again, this is Antarctic krill. It contains the highest naturally occurring levels of omega-3 and DHA and EPA. So 2.5 times higher bioavailability of EPA and DHA compared to conventional fish oils. We always think that, you know, everyone's talking about amounts and quantity and like, I want 2,000 milligrams of DHA. It's not necessarily how much you have, it's the quality. And this is something we have to be able to speak on with our clients and patients, just so that they're aware that you don't necessarily need what the media is telling you. You actually need what your body can absorb. And if it's going to absorb all of something, you're going to have the benefits of it. It doesn't, you know, you have to just make sure that we explain that properly. And it's a small fish. It's a krill, so it's going to have less toxins in it just because of the fact that it's a little crustacean rather than a fish that is, you know, can be more toxic and have mercury in it. And then it's got this enhanced transportation of omega-3s and antioxidants that cross into the blood-brain barrier. Okay. This is why to use Toco-x-krill. Again, there's a picture of a heart and a brain just to like solidify that connection that you can see. It improves brain health, cardiovascular health, joint health, women's health, cholesterol. But I just like to think of it as like a lovely picture between the brain and the heart. And the heart really works well, this Toco-x-krill, with our self-tonic. We actually have a bundle, and it's called the Heart Recovery Kit. So you can see this later when you have a chance to see all the dosage recommendations. Okay. And now back to Heather.
All right, so we've got 2 more things we're going to cover here. Thanks for sticking with us, everyone, as we are going through our Biomed top 10 and how to be very successful with all of these products. So next what we're going to talk about is the Asta-x-krill. And so with the Asta-x-krill, it is the sister or the cousin of the Toco-x-krill. Toco-x-krill is very much about, as Rhiannon mentioned, neuro, brain, cardiovascular. Asta-x-krill definitely has the neurological component, but it also has heart and joint is the main differentiator between the two. So the Neptune krill oil, which is found in there, plus astaxanthin, there is the benefits, or the features, it's bound to phospholipids. So therefore you have better absorption across the blood-brain barrier, Rhianna's favorite word tonight, and also into the cell membranes. And that's the whole thing. When you're using these oils and these omega-3s, you want them to get into the cell membranes because this is where they're going to work their best. It's brain food, again, because it crosses this blood-brain barrier. The antioxidants and the omega-3s get across there. It is stabilized with astaxanthin, which is a really potent antioxidant, and the U.S. triathlon team uses it as an anti-inflammatory and to increase stamina and endurance. So that's a pretty big claim for that. So with Asta-x-krill, it's the only product in the world that's a combination of this Neptune krill oil and added astaxanthin. So you have the naturally occurring astaxanthin that already happens in the krill, and then you have an additional astaxanthin, which is the orange color that you would see in shrimp or krill or lobsters or salmon. So it's protecting all the cells and the cell membranes and such. Okay, and so then, and Rhianna talked about quality versus quantity. So the quality is because it has this superior absorption, the omega-3s with the DHA and the EPA are definitely getting absorbed and targeted where they need to go in the body. And we talked about that with probiotics too. Like you want this targeted delivery system. That's what really matters. Quantity, not so much if you can get really good quality and to get it to go where it needs to. And so, just a few studies. These are both the Toco-x-krill and the Asta-x-krill, extremely well-studied products, really well-studied ingredients, ongoing studies for the Avenal SuperBio. They're putting out 3 to 4 human clinical double-blind placebo-controlled studies in research papers, peer-reviewed journals every year. They're associated with the Ohio State University, so they have a lot of money and a lot of research behind them. With the Neptune krill oil, again, they have the same thing. There's huge amounts of research that go into their products. And so here's just one quick study that they looked at inflammation and arthritis. And so they were using the marker, the C-reactive protein. And so for people that were on the Asta-x-krill, in 30 days they had a significant reduction in the C-reactive protein. And as you know, that's an inflammatory marker that can be a marker that indicates future heart issues or heart attacks. So it reduces C-reactive protein, so therefore it also reduces inflammation. And then osteoarthritis is also where it's really a strong product and strong for symptoms. And so, again, over this 30-day period, 30 days is not very long for a patient to be finding major symptomatic relief, especially in arthritic or osteoarthritic symptoms. So reduction in pain, and it was like 38% reduction in pain, reduction in stiffness, and in reduction or improved functional impairment, so better function. And so, again, with your patients, you're going to find super rapid effects at a relatively low dose. And 1 month is 1 bottle, and so your patients can be trying this out and finding the relief. And then not only are you providing the relief to them, but it's happening quickly as well. Okay, so benefits, very similar, but also very different from Toco-x-krill. As I mentioned, you've got the cardiovascular and the kind of cognitive neuro component to it. The joint health is the differentiator, and we talked about the inflammation and arthritis. Also, astaxanthin by itself has some additional benefits, increasing physical endurance, improved eye fatigue and skin health, and also helping with blood control and increased lipid metabolism. And dosing, we have some brochures, actually, we have some brochures right here. I've got pictures of them for you. So these are 4-page brochures, all the details that Rhianna just talked about and also what I just talked about for Toco and Asta, they're all in there. The studies are in there, the summaries of the studies, and all the dosing. So all the dosing for the joint health, for the cardiovascular, reducing cholesterol, eye health, metabolic health. And generally it's between 1 to 4 caps a day, depending, average of being 2 caps a day. So these are both available on the website, on the Biomed website, associated with the products. We can email them to you, so it contains everything you need to know. They're patient-friendly, so if you want to hand them out to your patients or have them in your waiting room for people to look at to see if they're appropriate for them, then these are the kinds of support material that we want to continue to supply you with so that you know what you're working with and have kind of the proof when people start asking patients, you know, how do you know, or is there research for it? And then the last thing we want to talk about is success with basic tab. And so to just shift gears a little bit, one of our strengths with Biomed, and always has been, is looking at the terrain, looking at the milieu, and acid-base balance. And so this is one of our acid-base balance formulas. It's in a capsule form. It dissolves within a minute in the stomach, and it really shifts the acid out of the body. When the mechanisms of the body, the detox pathways get overwhelmed, you start to get this acidic terrain. So the goal when you're working with an acid-base balancer is to flush these excess hydrogen ions out of the tissues. And so just to put it into perspective, an acidic terrain, it's prone to inflammation. It's prone to reactions like allergies. It's prone to toxicity. It lays down the groundwork for potential chronic degenerative conditions because the terrain or the matrix, if it's all congested, it means the cells aren't able to communicate. The cells aren't able to properly detox. They're not able to uptake nutrients, and it causes a lot of issues here. So always an acid-base balance remedy is relevant for almost every single patient. I always test all my patients with urinary pH to see where they're at and to see how well balanced they are. All therapies work better when somebody is in a proper acid-base balance. And I always have said an acidic body is a reactive body. One of the fastest things you can do to reduce allergies is to work on acid-base balance with people. Okay, so just to put a few numbers into perspective when you're looking at alkalizing, the urinary pH shows systemic acidosis of the tissues and how well the body's excreting acid, namely hydrogen ions. So there's some different ranges. The blood range is 7.34 to 7.43. It's a very narrow range, and it doesn't ever really go out of that range. The saliva can change during the day. Saliva is also a good indicator for mineral reserves in the body and how the adrenals are functioning, and the urinary pH is often very good at telling you what's happening in the actual tissues. So first morning urine, it's acidic, but if it's below 6.5 or below even 6 in the 5 or the 4s, then you know that the body's very acidic or the tissues are very acidic. With an alkalizer, then, you want your patients to be taking it twice a day, and it's always with warm water so that it doesn't sit in the stomach, and it's always on an empty stomach so it doesn't interfere with digestion. An alkalizer is not meant to be taken with food on the stomach because then it interferes with the hydrochloric acid and the actual digestion in the stomach. When you're alkalizing, you're usually doing it anywhere between 1 to 3 months. For most patients who've never worked on acid-base balance or don't eat a lot of fruits and veggies, have a very acidic diet, it takes up to 3 months to mechanically shift the acid out of their body. But during those 3 months, man, do they start to feel way better. Over time, you're reducing inflammation, you're reducing reactions, you're getting the body's detox pathways better, you're supporting digestion. You can improve heartburn just by working with acid-base balance. And this is one thing that's really cool, is that a lot of the time heartburn, acid reflux, it's not because there's too much acid, it's because there's not enough. And an alkalizer always is helping support hydrochloric acid production. So therefore, sometimes with patients, this is all I give. I don't give other things for heartburn, and it's amazing you can turn a case around working just with alkalizers. So you get less inflammation in the body, less pain, less allergic reactions, and less allergies, no more heartburn, improve overall digestion, helping to support that healthy gut. We talked about, again, with the probiotics, planting seeds in a soil that's ready, so an alkalizer helps with that. This is another component that's important when working with candida and reducing candida and fungal overload. It improves response in chronic conditions, and it helps to clean up the matrix, so you get better cellular detox. If you're talking to any practitioner that follows the European or German biological medicine, they're always going to be using acid-base balance. I know lots of practitioners, lots of your peers, who every single person gets tested, and everybody goes on acid-base balance if it's relevant for them, and they also all go on lymphatic drainage. And so working in that deep milieu, you're going to get better results overall with your patients. And so dosing for basic tab, it's 2 to 4 tablets on an empty stomach with warm water twice daily. And the main thing is the potassium bicarb and the sodium bicarb are your key ingredients. If you want to learn more about acid-base balance and alkalizing 101, we do have 2 webinars that are available online. in our archives on our website, and so you can learn all about that. Again, you can also reach out to Rihanna or myself, and we're happy to be able to talk more detail with you about that. Okay, and so then we want to pull it together to some degree with your Healthy Gut Protocol. And I know that you've heard us say it a few times now about this really awesome deal that we've got for all of you. And so after we go through the Healthy Gut Protocol, we're going to finally announce what this unprecedented offer just for you is going to be. So Healthy Gut Protocol, these are your building blocks for the foundation of a healthy gut. Healthy gut equals a healthy body. And so in this foundation, this is following, again, that German biological medicine. German biological medicine has been around for over 60 years. It is used with Dr. Rao at the Paracelsus Clinic, and they see the toughest of the tough cases. 300 outpatients a day, a lot of them have cancer, and a lot of them are surviving and turning their whole body around. And part of it is because they're focusing on the gut and they're looking at the acid-base balance. And so a healthy gut is the foundation for proper digestion, a strong immune system, and that's one of the things to really remember. It's not just about digesting and absorbing nutrients. It's also about having your immune system strong and functioning. A healthy gut also improves recovery from chronic illness. So the three things that are focused on in this protocol: acid-base balance, intestinal repair, and healthy gut flora. So Rihanna talked about NAG earlier today, so that's the N-acetylglucosamine, and that's working to repair the mucosal membranes in the intestinal tract. And so that would be 2 capsules a day. And then we talked about probiotic 7-in-1 and 1 capsule 3 times a day to be replenishing the flora and the fauna with the 7 different strains. And it's colonizing because it's moving through the stomach acid, so it's a very targeted probiotic. And then finally, we've got the basic tab, which we just talked about, and that's 3 tablets twice a day with warm water on an empty stomach, 20 minutes before food or 2 hours after. You want to monitor with monthly urinary pH testing just to see where people are at. And the basic tab, again, reducing inflammation, supporting a healthy intestinal environment for good flora, and helping, again, in supporting strengthening the immune system. Generally, patients, most patients, if they're new patients to you or they haven't been doing a lot of work on their gut, they haven't been doing a lot of work on changing diet, they're probably going to need to be on a program like this for about 3 months. And 3 months is the key. 3 months, it takes about 3 months for acid-base balance to really clean the tissues up. And the other thing is it takes 3 months natural regeneration cycle of the intestinal tract. And so you'll have an entirely brand new intestinal tract every 3 months. And so being on a gut program for 3 months is going to be able to, from the beginning to the end, support health the entire way through. And so here's the other thing too, like we're talking about success, this success with Biomeds top 10. So we don't always talk about the money part. We talk about how you're going to benefit patient health and they're going to improve from this symptom or that symptom. But here's something that you have to think about as well, because not only are you practicing practitioners, you're also running a business. Dr. Lauren Brown in last month's webinar, so June webinar, he talked about how to build your practice 10 times over. And one of the things is we all have to start thinking a little bit more like business people. Our main goal, of course, is to help and improve people's health, but we can't do that if we don't have a thriving business. And so here, Healthy Gut Protocol, you put 15 patients on this program for 3 months. So that's 3 bottles of 1 bottle of NAG, 1 probiotic, 1 basic tab, once a month for 3 months. And if you've got 15 patients on that protocol that commit to that 3 months, you're going to earn in profit over $2,100. And so that's, you know, that's great. That's rent. That's investing in yourself. And so, you know, it's something else to be thinking about with your practice. How are you earning your money, and are you having cash flow to be able to stock what you need to stock, and all of these types of things. And so there's just some broken general numbers for you that might be able to help you think about it in that term, with the end result, of course, with getting that patient's gut healthier, so overall they're healthy. Okay, so I invite anybody who's got questions, please type them into the chat room or please type them into the Q&A section. A few of you have been asking questions throughout the presentation, and so if you have more questions, you know, Rhiannon and I are super happy to be able to answer anything. We're also able, again, we're available via email and via phone to answer any other types of questions that you have regarding kind of our top 10. And so I just want to review one more quick time, just because it did come up as a question about saliva pH. And so saliva usually indicates mineral reserves in the body and how well the adrenals are functioning. It can change from moment to moment depending on what you're eating. Blood generally doesn't change at all. It's a very narrow range. There is indications within it, but I'm not going to go into detail today about that. And finally, urine is about how acidic or how well regulated the tissues are. Okay. And we do have, as I said before, we have presentations that are on that with those details, and we also have this other really cool chart that I can send out, salivary pH acid challenge, and that will, it's a 7-minute evaluation you can do using lemon juice and then taking pH of your saliva to see, again, how well there's reserves of the minerals in the body, and also how the adrenals are functioning. And this is a super easy in-office test that you can do with patients, or you can send them home with it and then know if they need an alkalizer or not, know if they need adrenal support, and know if they need to take some additional minerals. Okie doke. So with all of that said, here we are at the very end. And so thank you, everybody, for learning more about how to become more successful with Biomed's top 10. Rhiannon talked in the very beginning. Our top 10 is voted by you because this is what you're using with your patients, and the stuff that you're using and finding you're having huge success with, of course, then equals what are in our personal top 10 of what practitioners are using. Rhiannon, would you like to have some parting words?
Oh, yeah. Thank you guys for spending the last hour and a half with us. It was great. It was a lot of fun, and I think everyone can benefit from these products in their practice. And yeah, that's all I wanted to say tonight.
So thanks, everybody. Have a really wonderful evening.